you viewers. I'm Dr. Vinita Gupta, Senior Consultant OB and GYN. Now, I'll be talking or we'll be discussing about pregnancy and lifestyle in accordance and the things that you can do to manage your pregnancy well. Now, whenever the news of pregnancy breaks in, it is a time for excited it's a lot of excitement for the couple and the whole family actually. With the excitement comes a lot of expectations also, and you want the best for your baby right from day one of its conception. But this brings a lot of anxieties and panic also, because you don't want anything to go wrong and you want to do everything right for your babies. And this also, like along with the anxieties, you want a lot of assurance and reassurances regarding the symptoms, normal symptoms of pregnancy, like backache, abdominal discomfort, leg cramps, headache, fatigability, you're tired all the time. So you need a lot of assurance and reassurance regarding these symptoms, whether these symptoms are normal or they're abnormal. So instead of googling and talking about about these symptoms with your friends and family, it's better to discuss all these symptoms with your doctor. Because remember friends, every individual is different and every pregnancy is different, so you can't compare your pregnancy with anybody else's pregnancy. So you must discuss about all your problems with your doctor. Now, before we begin with this topic, what I would like to tell you is that pregnancy is a normal physiological phenomena, you know, and most of the pregnancies are usually low risk pregnancies without any complications. But having said that, some pregnancies do have certain complications, and they may have certain high risk factors also associated with this. So here comes the role of a good obstetrician. Your doctor will monitor your pregnancy. She will advise you appropriately and get certain investigations and ultrasounds depending upon the period of pregnancy. And these investigations are done at certain intervals of pregnancy. Depending upon the results of these investigations and the findings on examination, while taking your history and examination, the role of the doctor is to monitor and supervise your pregnancy and pick up early signs of complications, and also pick up any high risk factors if there are any. After picking up these investigations, your doctor feels that your pregnancy is in the high risk category, then your pregnancy maybe, she might require to do a close monitoring of your pregnancy. And certain treatments or management protocols are carried on depending upon the condition. And if required, a timely intervention and termination of pregnancy may be required in certain situations, so that the end result is a healthy mother and a healthy baby. Now, during this process of pregnancy, there might be certain conditions in which other doctors of other specialties may be required. Their help may be required, like a physician, a fetal medicine doctor, an endocrinologist if there are certain endocrine or hormonal problems like thyroid disorders or diabetes, or certain other hormonal disorders are there. Then role of an endocrinologist is very important. Then a cardiologist may be required if there are certain conditions in which there is cardiac problems associated with pregnancy. Then having said that, last but not the least is the role of the neonatologist, who will be, or the pediatrician, who will be handling the baby later on. So this whole process requires a close network of the patient, her family, her husband, her whole family, and the pediatrician, and if other doctors are required. So a close coordination of all the doctors and the patient and her family is required. Um, Now we are talking about the lifestyle management during pregnancy. Now the process of lifestyle modification has to begin in the pre-pregnancy phase. That is when you start planning for your pregnancy. So once you have decided that you want to, plan for your pregnancy, you must, know certain facts about yourself. You must be aware of your body mass index, which is actually your weight in kgs divided by the square of height in meters. So the ideal BMI before planning your pregnancy should be between 18 to 25. If the BMI is more than 25, then you are overweight. If it is more than 30, then you are towards obesity. And if it is less than 18, then you are underweight. So, what the studies have shown that the patients who have extremes of BMI, that is less than 18 or more than 25, they are more prone to complications. So, try to achieve an ideal BMI, though it may not be always possible. Okay. And then when you start planning for your pregnancy, you must visit your doctor for a preconceptional counseling. This is very, very important. The purpose of a preconceptional counseling is to look for any high risk factor in you. That is, after taking a detailed history and an examination, the doctor will advise you certain investigations. The purpose of the whole process is to look for any endocrine disorders like diabetes, thyroid disorders, or even a pre-diabetic state has to be picked up and taken care of in the pre-pregnancy phase, and then plan for your pregnancy. So rule out diabetes, rule out thyroid disorders. Then hypertension, if the blood pressure is on the higher side, then it has to be treated. And the medicines which are favorable for pregnancy or which are advisable in pregnancy should be started in the pre-pregnancy phase. Or if the patient was already on some medication for, say, diabetes or hypertension or any other medical disorder, then you must discuss about these medications with your doctor, and the medicines which are safe for pregnancy are changed over. So all the medical conditions have to be well controlled before you plan for your pregnancy. Then certain prenatal vitamins, that is folic acid in the dose of 1 milligram on a daily basis is started. So most of the medicines that are tablets that are available, they contain 5 milligrams of folic acid. So you can take that. So folic acid has to be started at least 3 months before you start planning for your pregnancy. Then in addition to the pre-conceptional counseling, you must do take certain steps for lifestyle modification. Now what you need to do is, first and foremost, is take a well balanced diet. In the diet, you need to take a high protein diet, and a diet which is rich in antioxidants and vitamins, so that before you enter the pregnancy phase, your body is in a healthy state. So a well balanced diet. So any kind of crash dieting is to be avoided before pregnancy. A well balanced diet and a well spaced diet meals is important. Then, in addition to your diet, a regular exercising schedule is very important. Mild to moderate exercises are aerobic exercises are advisable in the pre-pregnancy phase. Adequate rest, that is about 6 to 8 hours of rest every day on a daily basis, is important. Then these things are important in the pre-pregnancy phase. Now when you conceive, again you must visit your doctor. The doctor is going to carry on with her protocol, the investigations, the examinations, and the ultrasounds, whatever is advised will be taken care of by your doctor. What you can do is, there are 5 important points that you need to take care of. One is a well balanced diet. Now the golden rule in pregnancy as far as diet is concerned is, your meals should be small and frequent meals. So instead of taking 3 large meals, you must take 7 to 8 smaller portions of meals, which are to be properly spaced. So every 2 to 3 hours, you must take your food, and the meal portion should be small so that you're able to digest it. The diet should be rich in proteins. So the protein requirement during pregnancy increases because the baby is growing inside your womb. So you need to take a good high protein diet. The daily requirement for proteins is about 50 grams on a daily, roughly on a 50 grams on a daily basis. You need to take a diet which is rich in calcium. So milk and milk products is very important. So you must take about 6 to 800 ml of milk on a daily basis in whatever form that you can take. You can take milk, you can take curd, you can have cottage cheese. So milk in any form is okay. So 6 to 800 ml of milk is very much important. Then your diet should be, must take a lot of vegetables. A variety of vegetables is important. So a very good high fiber diet and a diet which is rich in antioxidants and vitamins is important. Then in addition to your diet, you must take nuts and dry fruits, because these are a very good source of omega-3 fatty acids, which is required for the neurological development of the baby. Then in addition to this, you must take fruits, so 2 to 3 servings of, or 2 to 3 fruits on a daily basis you must have. And you must add a variety of variety of fruits in your diet. In addition to your diet, your hydration should be well maintained. You must take at least 1.5 to 2 liters of water. That comes out to be around 8 to 10 glasses of water on a daily basis. In addition to your diet, lifestyle management is very important. Regular exercising. We are talking about a low risk pregnancy. In the first trimester, mild exercises are usually advised. In the second trimester, mild to moderate exercises are advised. Then in the third trimester, we can go on to back stretching exercises and pelvic exercises, so that we can work towards a normal delivery, if we have ruled out any high risk factor for a normal delivery or any other high risk factors during pregnancy. Now, addition to diet, exercise, rest is very important. So about 6 to 8 hours of rest in the night time and 2 hours of rest in the daytime is very important. Rest whenever you are lying down or resting. A rest in left lateral position is the most preferred position for resting, because the blood circulation towards the baby improves in this position. Then in addition to rest, meditation is very important, because during pregnancy you're going through a lot of physical changes, hormonal changes, emotional turmoil, and you are the only one who is able to understand what you are going through. So instead of panicking or getting anxious about it, it's better to control your anxiety and talk about all your problems with your doctor. And meditation for about 20 minutes on a daily basis, any kind of meditation, even breathing techniques are a good meditation way of meditating. And in addition to this, breathing exercises are very important, because remember friends, when the baby is growing inside, your lung capacity reduces, because with the growing abdomen or a growing intra-abdominal pressure, the lungs are pushed up. This reduces your lung capacity, and actually your lungs are working at double the pace, because they need to oxygenate the blood at a higher rate. So in order to maintain your oxygenation of the various tissues of your body and the baby, you need to do breathing exercises. So deep breathing, conscious deep breathing will increase your or inflate your lungs, so that you are able to oxygenate yourself and your baby. So these things are very important. And remember friends, most of the pregnancies are usually low risk pregnancies. Some of the pregnancies may be high risk, or there may be certain complications. But if you have planned your pregnancy well, that is, if you have taken care of your high risk factors in the pre pregnancy phase only, and you enter your pregnancy in a controlled manner, all your medical factors are controlled, and then if you go through your pregnancy, the complications are minimal, and they can be taken care of in most of the situations. So how you go about with your pregnancy is in your hands. And with the help of your doctor, you can go ahead with your pregnancy and have a healthy outcome. And so you will be in a better state in the post delivery phase, and your baby will be a healthy one. So the end result is good for both of you and the whole family. So that way, that is the way to go about it. So with this, we can go with our question answer session, if there are any questions. uh, what are the activities to avoid during pregnancy? This is a question from Ashima Sethi. So, Ashima, thank you for the question. Usually, what we say is that pregnancy is a normal, physiological condition. It's not a disease. You can carry on with whatever activities that you are carrying on earlier. So, if it's a normal low risk pregnancy, there is no restriction of activity. Suppose if you were swimming earlier on, if you are an athlete, or if you were swimming earlier on, you can carry on with all your activities during pregnancy. But if there are certain complications, like if the placenta is low lying, if there are certain factors which are giving us an indication for a preterm delivery, then the activities are avoided. So mild to moderate exercises are advisable during pregnancy. What activities to be avoided? Any abdominal crunches or exercises which put a pressure on your abdominal on the abdomen and the uterus. Those kind of activities are to be avoided. So aerobic, generally speaking, aerobic exercises can be done during pregnancies. A lot of activities which require jumping or abdominal crunches or abdominal bending, those kind of activities are the ones which we need to avoid. Now, the next question is from Mr. Rahul Kumar. My wife is 3 months pregnant and she has lots of mood swings. So, can you please suggest me how to handle her mood swings? So, what I advise my patients is, see, the patient is going through a lot of, changes. She is going through a lot of physical changes. There is a lot of hormonal turmoil which is going on in her body, and there is a lot of emotional turmoil which is going on in her body, and she is the one who has to go through all the discomforts and all the problems. So your role in such a situation should be to to provide a tender loving care to her, and just to show her that you understand all her problems. So it is not, we can't do anything, we can't give her any medication for this, but your support and the family's support is very important. Just to show that you understand what her problems, it will be enough for her. So a tender loving care is very important from your side to help her go through her emotional turmoil. Now, the next question is from Pallavi Gulati. I am 1 month pregnant. What is the proper diet I have to take during pregnancy? So, thanks for the question, Pallavi. So, Pallavi, you are in your first trimester. So, generally, I've already told you that pregnancy requirement, or the requirement of pregnancy, is a little different from the non-pregnant state. So if you are taking about, say, about 200, 2000 to 2200 calories on a daily basis, so out of the total diet that you are taking, about half of it should come from your proteins, rest should be from the carbohydrates, and about 5 to 10% of the diet should be from the fat content. So the three major proportions, the carbohydrate, proteins, and fat, should be so it should be 4 is to so basically 4 is 4 is to 4 is to 2. So you need to take about 50 grams of proteins on a daily basis. Now in the first trimester, the major problems, that at the stage at which you are, the major problems are a lot of, that the women are usually facing or going through, a lot of nausea, vomiting, gastritis, abdominal distension, and constipation. So these are the major problems in the first trimester. So what you need to do is take a well balanced diet. In addition to it, it should be split into smaller portions. So Pallavi, what we advise is, as soon as you get up in the morning, take two bland biscuits or two bread toast. You can take, so you can just take two slices of bread and toast it, and then you can have it right in the morning, the moment you get up. So this will kind of absorb all the acids that are produced overnight. So when you are not eating for about 7 to 8 hours, there is a lot of acid production, and when you get up and brush your teeth, this acid kind of regurgitates, and it causes vomiting in the morning, and it causes a lot of morning sickness. So you can have two bland biscuits, or you can take two rusks, or two toasts you can have. This will absorb the acid, and then later on start with small and frequent meals. Your meals should have a low fat content, so that you are able to digest whatever you are having, and it should be well spaced. So every 2 to 3 hours you must have your meals. Generally what women do during the first trimester is, they're not able to eat their meals because of the smell of the aroma of the food, cause it creates a lot of nausea. So what they do is they keep on taking a lot of fruits, and they feel that they're taking fruits and that should be sufficient. But that, believe me, that is not sufficient. And taking a lot of fruit diet in fact creates a lot of nausea and vomiting, because generally the fruits are have a little acidic tendency. So you must take your meals, the fruits have to be after your meals. So take small and frequent meals. Even if you're having lots of nausea, even small portions of meal will help you. And then maintain your hydration. So lots of liquids, it can be in any form. You can have water, you can have coconut water, you can have soups, homemade soups, you can have vegetable, you can have fruit juices, you can have curd, you can have lassi. So these are the things that you can take. And you must, broadly speaking, you must have 2 glasses of milk on a daily basis. Then you must have a bowl of curd and a little bit of paneer on a daily basis. This will take care of your dairy products. Then you must take 2 to 3 servings of dal and vegetables in all your meals, and then 2 to 3 fruits on a daily basis. Then, in addition to this, nuts and dry fruits in small portions you can have. So these things are important, broadly speaking. Now, the next question is from Swati Goyal. Ma'am, I'm second month pregnant and I have low BP and diabetes problems. So, can you tell me what are the complications I could face? So, thanks for the question, Swati. So, Swati, low BP, it's a normal thing. It happens during pregnancy, especially in the first trimester. Because of nausea and vomiting, you're not able to eat much, and this makes you a little low. So that is not a problem. You just need to take lots of fluids, so you may need to maintain your hydration. No medication for that, no complications due to low BP. Now diabetes needs to be managed properly. Sorry. Excuse me. Now diabetes needs to be taken care of properly. Sorry, I'm so. Diana, can I take a moment? I'm so sorry. So, diabetes is one thing which needs to be taken care of throughout your pregnancy, and it requires close monitoring. It depends upon the severity of diabetes, which is important. So, in severe cases, you might require insulin therapy, but in most of the case situations, diet and exercise will help you. Okay. Now, the next question. I think I can't go on. Hi, Dinah. I'm having a bout of cough. So, can I carry on later on, or can I answer these questions by texting? I don't know if it's going to go on. Now, the next question is from Mr. Surendra Singh. What is the best exercise in yoga for my wife? She's 6 months pregnant. So, Surinder, what I would suggest is mild to moderate exercises if a pregnancy is a normal low risk pregnancy. So even brisk walking is good enough. We don't advise anything, anything over the counter. So what we would advise is a brisk walking for about 20-25 minutes is good enough twice in a day, and deep breathing exercises. If you want to go in for yoga, it should be under supervision. You can't do it, just by watching a video. So it has to be under supervision. So I think is that's all. These Okay, thank you so much, viewers. And I'm sorry, I just had a bout of cough. So now, in the end, what I would advise is, again, manage your pregnancy well. It's very simple. Do not panic. Don't get anxious. And take your doctor's advice. Follow your doctor's advice and get all the investigations and ultrasounds that are advised by your doctor, and follow her advice. And so, in the end, have a safe Deepavali, friends. Bye for now.